You can reduce your risk of coronary artery disease through lifestyle changes and, in some cases, with medication. We spoke to Dr. Michael Bagheri at Desert Regional Medical Center in Palm Springs, who discusses preventative cardiology and what people can do to prevent coronary artery disease.
As an adult cardiologist, I see patients coming to the office or to the hospital in their, let's say, 40s, 50s, 60s, and above with heart condition. But when you trace this back, the problem is started probably in their youth. There is a studies that has shown that the cholesterol deposit in the arteries that results in eventual development of a blockage resulting in a heart attack or a stroke, it dates back to pediatric age, and it's called fatty streaks. So we know that these cholesterol deposits happen very early in life and is a risk factor. And as a child grows with the common obesity that we have, diabetes, sedentary lifestyle, and unhealthy diet, this is just like a fuel for that cholesterol deposit process. And eventually later in life, it will show up either in terms of a heart attack, a stroke, or arterial disease anywhere in the body. And as you know, 30% the cardiovascular disease, and in particular atherosclerotic disease, are the most common reason or cause of death in this country.
Dr. Bagheri gives his recommendations to help prevent cardiovascular disease.
The prevention comes in 3 different layers. Primary prevention, which starts early in life. Secondary prevention, which happens after a disease has already happened, and now we have to basically contain it and do some damage control. And tertiary prevention is after the disease has resulted in some sequelae and we have to deal with the aftermath. The main thing is to address the diet and the lifestyle. We know that having an aerobic routine exercise program, walking 30 to 40 minutes a day, preferably a brisk walk 5 to 6 days a week, is probably the best thing that you can do to maintain your cardiovascular health. Second would be to treat the risk factors that we do know of: diabetes, hypertension, and cholesterol. By controlling these risk factors, we can further reduce the risk of progression of the disease.
Dr. Bagheri talks about statins and other cholesterol-fighting drugs.
The new cholesterol management guidelines, which was established by American Heart Association and American College of Cardiology, was recently revised. This new guidelines is based on review of all the scientific data in regard to cholesterol and the statin drugs and other cholesterol drugs. And the consensus after reviewing all of this data, reviewing the indications of the drug therapy, the side effects of drug therapy, was that basically many people won't qualify for using a statin, but there's 4 groups that would qualify, and they are known as the net benefit groups. These 4 groups includes any person who has a LDL level more than 190 milligram per deciliter, anyone with established cardiovascular disease like coronary artery disease, history of a stroke, peripheral arterial disease, they would also benefit. Any diabetic patient whose LDL level is between 89 up to 190 or above would benefit. Like any other drugs, these are chemical agents, and in the long term they could have side effects. I think if there is one thing that I would recommend is having a healthy diet, eliminating or effectively reducing red meat and any fried food. And I always tell my patients, the more colorful you can keep your plate, the better for you. Add fruits and vegetables and you'll see a lot of benefits.